So what do we do to find out if we have osteoporosis? This is the bone density test by dual energy X-ray absorptiometry. You see a woman lying on a table here. This machine scans back and forth across her bones, gives you a picture of a hip, as is shown here, or a spine. It's a test that uses small amounts of X-ray, about as much as you'd get in a cross-country plane trip or living in Denver for a week. So it's very safe. And it gives you really robust information about your risk of fracture. For instance, in this study, where a lot of men had bone density measurements and then were followed to see who would have a fracture, the men with the highest bone density, the 25% of the men with the highest bone density, were compared to those 25% who had the lowest bone density. And you can see that these men had 12 times, more than 12 times, the risk of having a hip fracture. So having a bone density measurement is a good way to find out something about the risk of fracture. Unfortunately, very few men have bone density measurements done, even after they have an osteoporotic fracture. We know a lot more about osteoporosis in women, and women know a lot more about osteoporosis than men do, and we don't do a very good job of taking care of osteoporosis in men. These are some of the factors that contribute to osteoporosis in men. Increasing age, as I mentioned. If you've had a fracture before, you're much more likely to have another fracture. How many men have had a fracture? You men are at twice the risk of having an osteoporotic fracture in your future. Family history is very important. How many of you have a parent with a hip fracture? So some of you undoubtedly have parents with hip fracture. You're at twice the risk of having a hip fracture if your parent had a hip fracture. On and on, calcium, vitamin D undernutrition, weight loss, smoking, a variety of medical conditions. Your physicians should, and you should, know something about these conditions so that you understand your own risk of having osteoporosis. Effective treatments are available for men with osteoporosis, but as I mentioned, in both medical and lay groups, osteoporosis in men is not sufficiently diagnosed or treated. We've got a long ways to go to do as well in men as we do in women. One final word about testosterone. You're going to hear more about testosterone, but this is a subject that comes up frequently when we think about osteoporosis in men, because sex steroids, both testosterone and estradiol, are very important for maintaining skeletal health. So people who have hypogonadism have lower bone density and higher fracture risk. Men with prostate cancer who are treated with therapies that reduce their testosterone levels lose bone and have a higher rate of fractures. And there's a strong hypothesis that much of the increase in fracture risk with aging is related to testosterone levels. This represents measurements of testosterone in a large group of men over the age of 65. So these men down here with very low testosterone levels have prostate cancer and have therapy to lower their testosterone levels. There are some men who are older but have very high testosterone levels, but the average level of testosterone goes down with aging, and what I show here in this shaded area is the proportion of men, about a quarter of men, older men, who have testosterone levels below the lower limits of those expected in young men. And so it's those men who are thought to have hypogonadism merely because of aging that might be at increased risk of fracture. Does that mean that we should treat older men with testosterone? This is a very controversial area for a number of reasons, but I don't think it's time to do that. First, we don't know the benefits of supplementation. In other words, how well does testosterone reduce the risk of fracture? We don't have that data. Secondly, the risks of supplementation aren't well known. So if you give a man testosterone for years to protect his bones, what are you doing to his prostate? We don't have that kind of information. So I think that in terms of testosterone therapy, hypogonadal men with low bone mass should be treated with drugs that have more documented effects on bone. And there are a variety of osteoporosis therapies that will do that in hypogonadal men rather than treat them with testosterone. Again, controversial area. And one final thing, we've been talking about bone strength and fractures, but falls are very, very important causes of fractures. And again, in a large study of men over the age of 65, we asked men when they came in for their first visit, have you fallen in the last year? 21% of these men reported falling. The average number of falls were 1.5. Some men didn't fall at all. Some men fell frequently. I was surprised to see that of those men that fell, 8% had a fracture as a result of those falls. That's impressive. The number of falls increases dramatically with age. So men over the age of 80 fall almost twice as often as men between the ages of 65 and 70. And men who say that they had a fracture, had a fall in the last year, fracture much more frequently than people who said they didn't fall in the preceding year. This is the numbers of fractures over the years in men that said yes, the numbers of fractures over the years in men that said no. So falls, as well as bone health, are very important in terms of fracture risk. So in summary, osteoporosis in men is common. It's personally devastating, particularly hip fractures, expensive. The burden of fractures is probably going to increase as the population ages. We are understanding the cause of osteoporosis in men much better than we have before, which means that we can do something about it. We can detect this risk. Methods for identifying men at risk for fractures are effective, like DEXA, bone density, but we don't use them. Preventive and treatment approaches have been identified, but they're underutilized. Sex steroids are important for bone health in older men, but I think it's premature to treat with testosterone. We have better drugs that will do the job. And finally, falls are an important cause of fracture, and we need to recognize men at risk and prevent those falls. So I went fast, but I covered some important points, and thank you very much.